The double marker test is a crucial prenatal screening test performed during pregnancy. It helps assess the risk of chromosomal abnormalities in the fetus. This test is typically recommended during the first trimester, between the 11th and 14th weeks of gestation. The test is simple, safe, and provides valuable information about the developing baby's health. Unlike diagnostic tests like amniocentesis or chorionic villus sampling, the double marker test is a non-invasive procedure. It involves a blood test to measure the levels of two specific substances produced during pregnancy. By analyzing these markers, healthcare providers can identify pregnancies that may require further investigation. The double marker test gets its name from the two key substances it measures in the mother's blood, beta-human chorionic gonadotropin, or BHCG, and pregnancy-associated plasma protein A, or PAPP-A. Both of these substances are naturally produced during pregnancy, but their levels can vary. Abnormal levels of BHCG and PAPP-A can indicate an increased risk of chromosomal abnormalities in the baby, such as Down syndrome, also known as trisomy 21, or Edwards syndrome, also known as trisomy 18. It's essential to remember that the double marker test is a screening test, not a diagnostic test. This means that it can identify potential risks, but cannot definitively diagnose a condition. The results of the double marker test can help guide further testing and decision-making. If the test indicates a higher risk, doctors may recommend additional diagnostic tests, such as amniocentesis or chorionic villus sampling, to confirm any potential issues. Understanding the significance of this test can provide expectant parents with valuable information and peace of mind during their pregnancy journey. The double marker test is a simple blood test that plays a crucial role in prenatal screening. The healthcare provider will draw a small sample of blood from the mother's arm, typically from a vein in the crook of the elbow. This process is quick and usually painless. The blood sample is then carefully labeled and sent to a laboratory for detailed analysis. The results are usually available within a few days to a week, depending on the laboratory's workload. Timing is crucial for the double marker test to ensure its accuracy and reliability. It is most accurate when performed between 11 and 14 weeks of pregnancy, a critical period for fetal development. Performing the test within this window allows for early detection of potential risks, such as chromosomal abnormalities, and provides expectant parents with ample time to make informed decisions about their pregnancy, ensuring the best possible care for their unborn child. Interpreting the results of the double marker test involves considering several factors, including the mother's age, ethnicity, and the levels of BHCG and PAPP-A. These elements are crucial in determining the overall risk assessment. The results are usually presented as a risk ratio or a probability. A higher risk ratio or probability suggests an increased chance of the baby having a chromosomal abnormality, such as Down syndrome or trisomy 18. It's important to remember that abnormal results do not necessarily mean the baby has a problem. It simply means that further testing may be recommended to get a clearer picture. If the double marker test reveals an increased risk, the doctor may suggest additional screening tests, such as the nuchal translucency ultrasound, which measures the fluid at the back of the baby's neck. Another option could be cell-free DNA testing, which analyzes fetal DNA in the mother's blood to provide more detailed information. Ultimately, the decision to pursue further testing rests with the expectant parents after discussing the risks and benefits with their healthcare provider. This collaborative approach ensures that parents make informed choices that are best for their family's health and well-being.